Good morning. Thank you for joining us for a presentation and discussion with the 2020 Innovations in Alzheimer's Caregiving Awards winners. I'm Calvin with Family Caregiver Alliance and would like to say a few words about our organization. For more than 4 decades, FCA has provided direct services and support to family caregivers of adults with physical and cognitive impairments. FCA also advocates for caregivers in the areas of policy, research, and public awareness on the local and national levels. To find out more about FCA or access our online tool, CareNav, please visit us at caregiver.org. So for today's presentation, your phones and mics are going to be muted. Please use the chat box for your questions or comments. Before turning it over to my colleague, Tatiana Marskal, I'd like to give a big thanks on behalf to all of us at FCA to the Caregiving Awards generous funders, the Rosalind and Arthur Gilbert Foundation and Bader Philanthropies. And with that, I'd like to turn it over to Tatiana.
Hi, everyone. So I want to echo my colleague Calvin and give you a warm welcome to this webinar. This is my second year being a part of this team, and I must share with you that this is one of the parts of my jobs that I enjoy the most. I get to learn and connect with programs that are doing great work to meet a growing need within our community. So before we dive in today's agenda, I'd like to launch a quick poll to identify your interest for joining us today. Calvin, can you please launch the poll? You should see a poll pop up in your screen. Please take a moment to make your selection. And we'll give you a few seconds here. Calvin, let me know if you can see the poll results.
Yes, would you like me to read those out for you?
Yes, please.
Sure. So we have 11% who would like to replicate one of these programs in their community or state. 26%, they like to support community-based organizations doing good work. 28% care for someone living with dementia and want to encourage more programs like this in their communities. And finally, 33% would like to learn more about the awards and the qualities of the programs that are selected as awardees.
Great, thank you. So I see we kind of have a mixed audience. So let's start with a brief overview, and hopefully we'll be able to provide you with enough information that you're looking for. So during this webinar, we will be highlighting the 3 award-winning programs with the hopes that it will encourage other creative programs to develop across the nation in support of individuals living with Alzheimer's disease and other related dementia and their caregivers. We'll also have the opportunity to participate in a panel discussion. So I invite you to be a part of this conversation. So ask questions, share comments anytime during this webinar. You can do this by using the Q&A or chat function located at the bottom of your screen. So before we jump into the presentations that we have, I want to share some background information on the awards. The awards were established thanks to a partnership of the Rosalind and Arthur Gilbert Foundation, the Baylor Philanthropies, and Family Caregiver Alliance to raise awareness of the programs and organizations working hard to improve the lives of individuals with Alzheimer's disease and caregivers. The funding organizations have a deep and personal connection with this cause and personally experienced a family member with Alzheimer's disease. And through this award and other efforts, seek to improve the health and well-being of individuals with Alzheimer's disease and caregivers. We typically receive around 80 applications per year from programs around the US. And one program from our 3 categories, creative expression, diverse multicultural communities, and public policies are selected and awarded $20,000 each. So at the end of this presentation, I'll be sharing a link to where you can go and find more information about the application process and also look at our past awardees. So saying that, I would like to welcome and introduce our 2020 awardees. We have Christian Duchette, Director of our Community Engagement, Caring Kind, the Heart of Alzheimer's Caregiving, based in New York, recipient of the Creative Expression Award for Caregivers Storyteller podcast. Calvin, can we move to the next slide, please? And I'll hand it over to Christian now.
Hi, Tatiana. Hi, everyone. I'm Chris Doucette. I work at Care and Kind, the heart of Alzheimer's caregiving. I'm so happy to be here. We are so proud of this recognition. You all know that there's not a lot of fame and fortune in the work of Alzheimer's caregiving. So when there is recognition like this, it really is meaningful. And we are so grateful to the Family Caregiving Alliance and Bader Philanthropies and the Gilbert Foundation for this award. So let's get right into it. We are being recognized for our podcast, Caregiver Storyteller. It's a storytelling podcast about Alzheimer's and dementia caregiving. We don't teach tactics about how to care for people, like how to eat and bathe and deal with sundowning. It's really an interview show where caregivers talk about the real world personal dimension of the impact of Alzheimer's caregiving on themselves and on their family. If you want to go to the next slide. And so the question is, why did we do a podcast? Well, we're an independent nonprofit organization. That's me on the left, with my guest Rob on the right. And we wanted to, we changed our priorities a little bit from research for a cure to supporting caregivers. And when we did that, we said, what's the best way that we can support caregivers with a limited budget, right? We're a nonprofit organization. So we landed on this idea of a podcast because podcasts can achieve multiple ends at a very low cost while running 24/7. And when I say low cost, I mean low cost. The setup cost for my podcast here is under $400. You can see in the picture, there's 2 microphones, 2 cables plugged into a mixing board. And that's it. That cost about $365 or something like that. There's also a laptop, but everyone has a computer already, and audio editing software is free. So really, the cost of this podcast is really just $365. Plus, of course, time. Time is the biggest element when it comes to the resource that you would need if you wanted to do a podcast like this yourselves. And why did we do storytelling? Well, in 2017, when we had this idea, we saw that there were already a lot of good podcasts out there that taught tactics. But there were no podcasts that talked about the personal dimension, the confessional storytelling about the behind the scenes of Alzheimer's caregiving. And while tactics are important, they're hard to remember, right? Stories stay with you. And one important thing to note, though, is even though I say that we don't teach, it doesn't mean that caregivers aren't learning. When you hear about other people's stories, you learn, and you learn a wide variety of things. And we'll talk about that in the next slide. So our original goal was to inform, support, and connect. But the truth is, we just took a chance and hoped for the best. We knew that these stories had value, but we weren't really sure, what element of the stories would have the most value. And after 3 years of the podcast running, this is what we learned. We learned that the podcast is reducing isolation, managing expectations. It's affirming caregivers wherever they are in their process. It's informing caregivers, and it's normalizing asking for help. Now, we don't use that, storytellers don't, our storytelling guests don't use those words. But when you're a listener, what you hear is that you're not alone, and that no one can do it alone, and that there's not just one way to do caregiving. We have a diverse set of caregivers, storytellers some have money, some have less money, some have supportive families, some don't. And so from hearing story after story after story, listeners hear the diversity of situations that everyone's in, and listeners hear that there is no one-size solution for anyone, and that people are doing the best they can. And if you're doing the best you can, then you're doing okay. And it normalizes asking for help. I had a caregiver come to our office once and say, I was caring for my mom, it was getting too much. And I started listening to the podcast, and I realized, wait a minute, everyone else is getting help. Why aren't I? So she made the call, and she came into the office, and she got connected to care. Now, how do we measure impact? How do we know that this is actually happening? Well, we know about the impact of the podcast for 2 main reasons. Number one, listener feedback. From iTunes reviews, emails, and in-person reporting, like the story I just told you. And also podcast metrics, like the number of listeners we have and how much time they spend listening to the podcast. In podcast, metrics are always interesting because everyone loves numbers, but the truth is metrics actually are interesting at first, but they don't and they have some value, but not very much. And I'll explain why that is in a minute. And one important thing to note is that listeners are anonymous. There is no way to contact or survey them. So if someone listens, I won't know what their experience is unless they proactively get in touch with Care in Kind, either through email or iTunes reviews or coming to the office in person. Next slide, please. So everyone loves metrics, so I'll start here. Within a few months, the Caregiver Storyteller became the #1 caregiving podcast on iTunes. We've got 62 ratings, 4.5 out of 5 stars. We've had over 6,000 visits to our podcast website. Our average iTunes listeners are 123 listeners per month, listening to 115 hours per month. That's about one person listening to 2 episodes every month. And we've got 123 people on average. Our peak was 2019 with 210 hours. So if you add up all the hours from the iTunes, from our website, and from Spotify, since launching, we've had 5,347 hours of total listening time. And if you think about the podcast as like a full-time employee, that translates to about 2.5 years of full-time support, which is kind of an interesting way to look at it. And for those of you in nonprofits and program evaluation yourself, you're thinking, these are nice metrics, but so what? Metrics say nothing about impact, right? The question remains, how are we improving lives? In my opinion, it's better to have 10 listeners getting meaningful support than having 1,000 listeners reporting no support. And that's why I'm really happy that people are reporting that they've gotten meaningful support from this. Next slide, please. And by meaningful support, again, people have to proactively let us know. And these are the kinds of things that they tell us. They say things like, I'm not going to read them all, but they say, when are you posting more episodes? These were so helpful, knowing you're not alone. I'm glad to know that I'm not alone with my thoughts and emotions. The stories are wonderful. It's helpful to hear what others are doing and how they're handling it. So, it's one thing to read a brochure on how to handle things. It's another thing to hear a person's first, person unedited experience about how they handled their situation. Next slide, please. And that's it for me.
Thank you, Christian. I really appreciate it. All right, we have next speaker is Dorothea Harris, Program Director, Senior Service for Volunteers of America, Minnesota, Wisconsin, based in Minnesota, and the recipient of the Diverse Multicultural Communities Award for her culturally responsive caregiver support and dementia services. Hi, Dorothea.
Tatiana, thank you. I'm delighted to be here. Hello, everyone. First, I want to send out a big heartfelt thank you to the Family Caregiver Alliance, the Rosalind and Arthur Gilbert Foundation, and the Bader Philanthropies for this recognition and award, which acknowledges the rich and impactful work of the culturally responsive caregiver support and dementia service team. Our advocacy and pioneering efforts to reach persons with dementia and their caregivers within the community has been changing and has been life-changing and life-saving for those diagnosed or touched by Alzheimer's disease or related dementias. Next slide, please. For 125 years, Volunteers of America, Minnesota, and Wisconsin has stepped forward as community builders, working to close gaps between people and possibilities. Volunteers of America, Minnesota, and Wisconsin looks forward and looks towards the future, challenging inequities, while generating powerful results that has impacted the lives of 25,000 people annually. Next slide, please. My home state of Minnesota is leading the nation as one of the major states that has some of the highest numbers of racial and ethnic inequities, some of the highest numbers of Hmong and Somali populations in the United States, and some of the highest numbers of incidences of chronic diseases in the country. So being awarded the 2020 Diverse Multicultural Award for the outcomes we have accomplished in serving racially diverse caregivers and those they care for here in Minnesota is an awesome achievement. There is hope. This award means we are ever so slowly moving the needle towards health equity. Thank you again for this acknowledgement. Next slide, please. So one of the ways we can serve African Americans, East Africans, and the Hmong communities is through the work of racially diverse community health workers. The CHW model supports our project and overcomes major barriers simply because they are from the same communities of those we serve. They share the same cultural beliefs, languages, and heritage of the older adults, caregivers, and those they care for. Next slide, please. Another way we can serve African Americans, East Africans, and the Hmong communities is by acknowledging that caregiving is a family tradition. It can be private, confidential, and not subject to outside scrutiny or inspection. We call caregiving a labor of love. Our culturally responsive program respects and honors tradition. My team is humbled to give families the gift to safely remain in their homes for as long as possible. It's called aging in place. Isn't that what we all want as we grow older? Next slide, please. Coming down the timeline. We offer a helpline in 4 different languages: Somali, Oromo, Hmong, and English. We make it easy for anyone to make a referral or register for our services through this helpline. Finally, you can find us in our new Healthy Aging and Memory Mobile Clinic. From a grant through the Administration on Community Living, Volunteers of America, Minnesota, Wisconsin acquired a mobile clinic to serve the community. The Healthy Aging and Memory Mobile Clinic is the first of its kind in the United States to be dedicated to memory screenings, which can increase access to an early dementia diagnosis and provides culturally sensitive services right where people need it the most, in their own community. Video clip, please.
At Volunteers of America of Minnesota, we are committed to closing the racial gap of awareness in dementia and early screenings. Dementia is not a normal form of aging. If you care for a loved one with dementia, call our caregiver support and dementia services today and find out how we can help. We offer free screenings and support groups for people of color, all aimed at keeping your loved one in your home longer. Call us today at 952-945-4034 to learn more about what we can do for you.
Thank you, Dorothea. This is a wonderful presentation. And
Yes.
just a little reminder that we will be sharing information about the awardees and where you can look at the rest of the summary description at the end of this presentation. So we have our next awardee, which is Donna Benton, Director of the University of Southern California Family Caregiver Center, a recipient of the Public Policy Award for the California Task Force on Family Caregiving, Picking Up the Pace of Change in California. Welcome, Donna.
Thank you. And thank you so much to the Gilbert Foundation, Family Caregiver Alliance, and the Ruth Bader Ginsburg Foundation. It's really an honor to be able to represent what is a task force of people who put together and put forth public policies to help influence family caregiving policies in California, hopefully for the next 10 to 20 years. Go next slide, please. So one of the things that really spurred us is that it's always helpful to have a leader, a champion in some type of leadership role within government. And then in this case, it was Cheryl Brown, who, because of her caregiving experience with her husband, felt that California should have a roadmap for how we are going to help family caregivers across all generations and within families, and to use that term caregiving very broadly so that you're helping policies that not just help people of what might have been a traditional family of parents and children, but also include friends and aunts and uncles, and be able to identify those family caregivers, families and friends caring for each other, and to have some support so that they can be there, support their relatives, and not have policies and procedures from, at least in government, that make it that much more difficult for them to do what everybody really wants to do in the long run, which is care for a family member when they're not well. So that was our legislative leadership. Next slide, please. From the leadership, we also, I represent what was a task force that was put together by selecting people from all walks of life who represented both those who are caring for somebody, people that were with the Alzheimer's Foundation or with in-home support services, people who had worked with the Family Caregiver Alliance, or they may have been working within the city departments that worked with family caregivers, or they were doing research in caregiving. So one of the things that was very important for the task force is to be representative of everyone in California. And so the task force members come from all over California, rural, urban, and they all had the one mission, which is to make government more responsive to caregiving and to come together with recommendations that would be actionable. That was one of our keys, is we really wanted to make sure recommendations that came out from the task force could be broken down into actions that could be taken both at large government levels, but also at city and neighborhood council levels. Next slide. Of course, a lot of this is not done, especially during lean times. It's very difficult to get task force funded, but the AARP and the Archstone Foundation stepped up to provide the necessary funds so that the task force could meet on a regular basis and have a way to have a team that was led out of the University of Southern California, who provided the administrative background and did a lot of the research, so that when our recommendations went forth, they were grounded in research that had been done around in the areas of caregiving, but also they were able to collect focus group stories so that we had a combination of research and on the ground stories that we could put forth in a report that we hoped would be interesting and allow people to read. This is a 3-year task force, but the research and the recommendations were given out over the course of the task force. So we didn't wait for 3 years to come up with this big report. We actually began to put out ideas and recommendations so that actions could be taken the full time that we were working together as a task force. Next slide. Finally, in our final recommendations, we tried to put the recommendations in larger buckets with a lot of sub-recommendations that were specific for California, that we felt were things that could be done over the course of 2 to 3 years, some immediately because of what was going on in the legislature. And also we had an overall philosophy that the recommendations always had to be grounded in equity, inclusion, and as far as the kind of having those ideas baked into the resolutions and not just sprinkled on the top of the resolution. So that was our overall, we had that part of our mission. And then we were able to come up with recommendations that were to be able to be used across different state departments, from transportation to work-life balance, being able to integrate family caregivers into hospital settings where we know that that's a process where sometimes that's the first time people learn that they're family caregivers. We wanted advisory councils so that there could be some accountability for these recommendations. And we wanted to make sure that the recommendations were some that could be adopted by other task force, other groups that were moving forward with legislation. And in particular, we also wanted to make sure that assessments became a part of what was done so that caregivers could begin to be self-identified by agencies and other service organizations. Next slide, please. So we're really happy. We knew that once the recommendations came out, one of the key things to keep things not sitting on a shelf is that you have to get your recommendations into bills. You have to disseminate the information. So one of the, what we did as a task force is everybody presented everywhere. We took those, we made copies and we did one-pagers, and we had very, bullet points and PowerPoints. And we just started talking to every legislator, every foundation, and as many people as we could to make sure that when the bills were going out, that they would include and think about caregiving. So we're happy that there were a lot of proposed bills, that went into California, like tax credits and respite, paid sick day improvements. We're still looking at chosen family and trying to get that definition of family opened up to meet the modern family structure. Looking at discrimination and bereavement, and all of these are bills that are still being pushed forward by different people. Next slide, please. And we've had a lot of bills enacted, so we're really proud that the task force that we served as model language for some of the Alzheimer's task force, the caregiver resource centers in California were able to be funded for technology and innovations in technology. And most importantly, the master plan on aging, which was released this year, adopted a lot of the language out of the Caregiver Resource Center Task Force, and those bills are being moved forward as we speak for the next 10-year plan, along with overall accountability of how we're moving caregiving policy for the state of California. And of course, we took our programs and recommendations and not just kept them with California, but we also share them with other national organizations. And even more recently, I think some of the ideas that we had showed up in Biden's speech more recently. So we're very proud to have been early on in looking at caregiving issues and seeing that it has taken on national impact. Next slide. And that's it. So we're in the master plan for aging. And I would say for any state that you're looking at, you need that leadership, but we do a lot of things post. We're still meeting, and this award will allow us to continue to push forward bills and policies that work for family caregivers and make adaptations, because you think a bill, it's like, oh, we got this paid sick day bill, and then we find, well, guess what? Not enough people from low income communities are able to use those paid sick days. And so we will go like, oh, now we need to look at job protection. So we work across generations, and we work with a lot of different collaborations in our goal to make sure that caregiving is not in the shadows when we think about national policies. And that's it. Thank you.
Thank you, Donna. So I want to thank all our panelists for an amazing presentation and really commend you for all the work that you do for your organization and your community. So I would like to now start the panel discussion with a couple of questions for the awardees. And I really invite our audience to join this conversation through the chat or Q&A, and I will do my best to triage your questions to the awardees. All right, so here's the first question. Ready? All righty. Okay, so it's clear that each of your programs have had an impact in your community in multiple ways, whether that's providing a space for caregivers to share personal stories, build community trust and awareness among racially diverse caregivers, and advocate for caregiving policies. And as we know, developing a program typically requires a great deal of awareness. And as our panelists have mentioned, it requires time and energy to create, implement, and oversee its success. So I would like to start with Christian. Can you tell us what problem you and your organization were seeking to solve by your efforts?
Sure. The problem that we were trying to solve is the problem of getting resources to caregivers. Everyone knows that caregivers need help because no one can do it alone. But it's also impossible for many people to leave their home to get the resources they need. And not everyone can travel. Not everyone can travel at the right time and day for a specific meeting in an office that's, maybe 20 minutes or 40 minutes or an hour and a half away from your home. So the podcast was designed in order to address that accessibility problem, really. We have a lot of resources, but you can't necessarily give them to people easily. And the podcast was a way for people to access at home on their phone. And that was the main problem that we were trying to solve.
Thank you, Christian. Donna or Dorothea?
Okay, I'll go. So I think it's important first to know that our caregiver support and dementia services was co-created in partnership with African-American caregivers. So together we learned that traditional evidence-based caregiver support programs just did not adequately account for cultural differences in many family structures or preferences. So this became apparent as other racially diverse caregivers self-identified as wanting to participate with the culturally specific groups. So as we all know, caregivers are the backbone of our society. So yes, it's very important to put a lot of value on the caregivers and intentionally support their work that they are doing. So the problem was diverse older adults and caregivers were seeking a culturally sensitive, confidential safe space where they could receive information on community resources and get emotional support for their labor of love and having the opportunity to connect with other caregivers on the same journey. So as we instituted these services, we also included respite care services for care receivers as caregivers participated in this program, and it was really received largely by all racial groups.
Sure. I would say the key thing that we were really trying to focus on is to bring awareness that caregiving is really everybody's business. It's something that we do so naturally that we forget that it's part of our family structure and that it impacts our work, our joy, our spirituality, our families, and everything around us. But we forget that caregiving is so prevalent that we take advantage of the fact that it's people don't talk about it. We just do it. So we felt that it was very important to show how policies need to focus specifically on caregivers. We know it's very important to focus on the people that they're caring for, but a lot of the structures that we have in place do focus on the person with the illness, but the person who's caring for them, we don't want them to go down because then our whole system falls down.
Thank you. So I would like to move on to our next question, and let me set the stage for you guys. So many of us may be able to relate that when you're venturing into a new field, project, or area, whether that's large or small, it can be a very exciting time, but it could also be a little scary and intimidating at times. So as much as we plan, some things just don't fall into place and we're forced to reroute our plans, problem solve along the ways. And speaking of experience, rarely is the path to success a straight line. So what were some discoveries that you made along the way as you developed your program? And I would really like you to take a moment to reflect if there were any barriers that you faced that you could share with us, and what unexpected opportunities did you uncover or learn from? I'll open it up.
Well, one idea comes to mind right away with the podcast. And when we were developing it, there was a big fight about how long each episode should be. And I thought it should be as long as the story lasted, and everyone else was like, no, it's going to be 5 minutes, 2 minutes, 30 seconds. Everyone's attention spans are nothing these days. And so you got to get in and get out. And so we wrestled with this idea of like, how long should it be? And how edited should it be? And if someone says something inappropriate, do we, should we edit it out? And so it became a lot of how do we manage the details of the actual episode, because it reflects on Care and Kind and the work that we do. We decided, you know what, let's just record a bunch at first. Let's record 5. And let's see how it goes, and then we'll cross that bridge when we get there. And so we discovered that nothing crazy happened, and the story, the moments in the stories that were uncomfortable, were part of the authenticity of the story, right? Because caregiving isn't comfortable. So when you hear something that's a little bit hard to hear, that means it's true. And if it's true, it means it resonates with people, because that's what people are actually experiencing. So we realized they whether it's 5 minutes or 30 minutes or 40 minutes, and they on average they're about 35 to 40 minutes. People listen. Because so it ended up being that as long as the story took is how long the episodes were, and they all averaged out to be about 35 minutes at the same, not on purpose. So that was kind of interesting.
Alrighty, so I can remember so many times when we were out with the mobile clinic, we were just so moved by all the health equity gaps that people were dealing with, the diseases, the sicknesses, infections, chronic illnesses, and they were actually seeking medical information and support from us. And our focus was really dementia and caregiving and bringing awareness to that. And so we discovered right away that we need to have a stronger ties with the medical community, the clinics and the hospitals. We needed to make sure that we not only gave those that were seeking services warm referrals, but we needed to make sure that they were connected to these clinics and hospitals because they weren't going. So that was part of our follow-up that we instituted. We made sure that the CHWs, made sure that people had transportation to get to these clinics and hospitals, and then advocate and follow up for them, and making sure that they were connected to primary doctors to make sure that they would start going on a regular basis. So that was a big discovery that we found, but I'm so glad that we were able to, make the transition and change and help everyone that came to the mobile clinic.
I would say that we had a couple of challenges. One was that we were trying to represent all of California, and that's a big ask. All the different groups, and what we did find is, like, where do you meet when you really want to try to meet somewhere? And California is very large. So we were only going to have in-person meetings. We had to change that so that people some parts of our state wouldn't have to spend overnight and half of their salaries coming to a meeting. And then part of the representation for California also meant that we had to add members and make sure to have more invitations of people having special meetings so that they could come to the meetings while they may not have been formally invited by the legislature. Their opinions were very important, and so that we were able to incorporate the audiences, what you called your audience and public hearings, because we're under the Brown Act, but making sure that we spent a little more time in public comments so that those got incorporated into what we wanted to be a very dynamic plan that really could speak to many communities. So.
Tatiana, let me add that because dementia was not a real familiar word for East Africans and the Hmong cultures, that it was a bit challenging on how best to serve them. So in many instances, dementia was viewed as a form of mental illness or simply as an aging old person disease. And so we really had to get creative and come up with some strategies on how to teach health, aging, and memory challenges. And we did that by making it an ESL class. And in that class, that's when we brought the education of health, aging, and memory challenges. So that was a big discovery that we weren't prepared for, but we were able to shift and make the change.
Thank you, Dorothea. And I would like to just open it up and ask, as what you ended with, Dorothea, that being a discovery and an unexpected opportunity to learn from. So can Donna and Christian share a little bit more of what were these unexpected discoveries that you learned or you pivot to along the way?
I would say one of the big unexpected discoveries was being able to link to other collaborations that were in other states where they were talking about caregiving, and finding out how caregiving was viewed pretty differently in other states, and who they were reaching out to, and understand and really looking more across generations. We specifically did not include family members that were in-home support service family, because we thought that that was really going to overwhelm our overall look. But young caregivers became one of those things that we looked at as like, oh, wait, there's these 18 to 25-year-olds who are in college, and being on a college campus, we learned very quickly that they should be involved in this discussion. Chris?
Yeah, that was great. I was just listening and thinking about that. One of the unexpected discoveries for the podcast was that about how quickly it became a part of the organization itself. You know, when we created it, we thought it was going to be just kind of a nice add-on to our long list of services, but it quickly became kind of a platform for us. It became a platform not for us, but for caregivers themselves, and how much they took ownership over their story and how they wanted to share their story, and how people, and how it then became a platform to talk about other things. It's mostly about caregivers sharing their experience, but we've had a couple of experts, expert dementia care coaches. We've had an author talk about nutrition. So we've had a few other things. And we've also been able to, talk about, connect with people who are interested in engaging with Care in Kind in a greater way. So one of the podcast guests then started a walk team and started walking for us. And so it just really became an opportunity to communicate the very heart of what we do, which is caregiver support, which is sometimes kind of hard to communicate in a corporate way. But when you listen to a story, then it becomes very clear what we do. And it was surprising how quickly the podcast really became a major part of our core services, really. And it's once you create it, it kind of lives on its own. So it's kind of strangely passive and active at the same time. So that's been interesting.
Thank you, Christian. Just looking at the chat and some of the Q&As, a lot of people are wondering, how did you build this relationship with your community? How did you recruit for Christian, your podcast? And how did you get other people involved? So I'll leave it there.
Well, I can answer the podcast question because that's very easy. And that is that Care in Kind has over 80 support groups, and each support group has 10 to 12 people in it. So right there is the first group of people I reached out to invite to be a guest on the podcast. And then from there, we believe that every caregiver has a story worth sharing. So there is a form on our podcast that says, if you'd on our website, which is careandkindnyc.org/podcast, you can submit your own story, and an email goes to me, and then I can reach out to people and we can schedule a time to do the interview. So it's really as simple as that. It's really, if anyone's interested in telling their story, get in touch with me and we can make that happen. We're still on hiatus because of COVID-19, but hopefully we can restart again in June.
Thank you.
Mm-hmm. So for my program, just coming out to the community really showed that we care. And we were really understanding and improving health conditions, specific to the locations that we were going to. And it was just kind of an overwhelming welcome to our community. And surprisingly, healthcare professionals that work with major medical health institutions were eager to join our community engagement efforts. They felt like they had more time to spend with their elders. So, we had medical doctors and nurses and pharmacists, that all speak the cultural language, and they came to volunteer and just be there and talk about medication and diet changes, and, encourage the elders to do monitoring their blood pressure and cholesterol and those kind of things. And so it was very well received in the community that we were focusing on the BIPOC population.
Thank you, Dorothea. Donna, would you like to add anything?
I think so much has been said so far, I think for us, there's always the barrier of just helping identify who caregivers are. And so when you're doing this at a legislative level, it really became quite a challenge. People don't understand. It's kind of amorphous and like, well, why do the caregivers, they're not sick. So why do we need to talk about them? What do they need?
Thank you, Donna. Yeah, definitely understanding just caregiving as on its own can be very challenging. And uh, I think about a language barrier. I think about community and cultural background. As a Latina myself, caregiving is already ingrained within our culture, and it's hard to separate that. Um, I'm just looking through some more questions here. I see one that is directed to Dorothea. What were some challenges that you faced or pushback when your service delivery program started advocating for diverse equity and inclusion for all underserved communities or refugees?
Yeah. So again, we started off with serving the African American population. So we already made a statement that we were looking for people of color. And it was just amazing how other cultural groups, I remember facilitating a support group, and we had a woman from Oromo come in the group. We had a Hispanic woman come in the group. And it just really is a testament that, people want good information. They want unbiased information. They want to be a part of something that is, very culturally sensitive, where they can take it and make it work for them. So, people self-identified where they wanted to be, but we thought that we would just take it a step further and make sure that we really targeted and spent more time with each culture that we worked with.
Thank you. Sure. We have another question, which I believe is intended for Donna. This person would like to see more recognition for family caregivers by the county and the government in general. Any thoughts on how that can occur?
They'd like to see more what by the county?
Recognition or acknowledgement. Mm-hmm.
No. You know what? This means that what Caring Kind has done, that's telling your story. That's how we begin to get recognition at any level. And you always think, well, my story isn't going to help, because it's just my story. But for the politicians and elected officials, when they hear stories from their constituents, they know that one story probably represents at least 100 other people. So telling your story and why what's important, why your caregiving is important to you, and what you feel like this would have helped me or this would help me right now. That's how laws get made. It's I wish there were a law, and your story is the I wish.
Thank you. Anybody else would like to add anything, Dorothea or Christian? Not at the moment. Okay, great. I see a couple of other questions. Okay, perfect. There's one that says, how has your program adapted through or during COVID? And I would like to start with Christian, since you briefly touched on that.
Yeah. We put the podcast on hiatus simply because I do one-on-one interviews in person. And one of the things that was very important to me in doing these interviews is that I wanted to make it personal so that people would feel comfortable to talk about very personal things. And that's hard to do over a Zoom or over a phone call. And so for me, the priority was being in person with people, which obviously we could not do during COVID-19. And so we just I just stopped doing interviews totally and put it on hiatus. But the interesting thing is, of course, I did not plan on COVID-19 happening. But what was interesting is that it really was a test of the podcast itself, because while we were on hiatus for the past 12 months or so, or 15 months now, the people kept listening. And so it wasn't a matter of people were listening because we were producing new content, every month. It was really because people were seeking us out. And so that ended up being a real learning experience for us about the value of what people were getting. People were proactively seeking out this resource, which tells us that there's a need for it. And we can't be the only need for it, right? So there's more need for, again, like Donna said, personal stories, because personal stories literally change the world.
So for my program, myself and my staff, we consider ourselves first line responders. And so we actually got, we call it suited and booted up, and we got out in the community and worked with our clients. We were fortunate enough to get a donation for tablets and a modem too, for those that didn't have internet. And so we worked with our clients. Of course, we followed all the CDC guidelines, but we went and made sure that those that needed to have tablets and modems to be able to stay in touch with us, we made sure that we supplied that for them. We made sure that we, brought the medication that they needed, made sure that they were getting the food. We actually covered and took care of our clients. We contracted with a nurse agency because our clients weren't going out and, going to the clinic and things as they should. Very, very scary moment or time. We're still going through it for the older adults. But we had people come in and make sure that they were safe and that they were cared for. And we had to let them know when, the CDC guidelines were changing and when they could go to the grocery store and, all of that. So we, again, have our helpline, and we started a program called Telecare. And they would call in and we would call out to them, and we just took care of our community.
Donna, how has COVID impacted your program and how you organize with everyone now remotely?
Right. I would say for us in particular, one thing is we learned how to do Zoom legislative visits. And that has become rather nice because it's easier to get constituents who normally had a difficult time leaving the person they were caring for. Well, now here they are on Zoom with the legislator, the legislative aide, and they can see what's going on in a home in real time and not necessarily in their office. So it brings that much closer. And actually, it's a little, in that sense, it was better. The other thing I would say is that COVID really brought to most people's attention, finally, the issue of isolation and depression. Yes. That is quite common with family caregivers. And maybe this is the first time people can really empathize with what it's like to be you, yourself, and maybe one other person at all times. And I'm not saying that this is how we want our society to have learned about what's going on with the family caregiver, but it did bring that forward for just about everyone now.
Thank you. I really want to commend you all because, it's hard pivoting, especially when you're given such a short time, when you have to leave the office and then you're gone, and and then working remotely, it's great that we have Zoom, that we're able to connect and, other technologies and, still be there within our community. So I know we're getting right about time for the webinar to end. And I just want to, again, thank you for all the information that you're sharing. And I would like to ask you, what advice would you have for others who want to set in a similar direction? Can we have Dorothea, do you mind sharing first? Any advice that you would have for any program that it's either starting off or wanting?
Well, so I would share that, I think that we stumbled on a culturally specific model that could be replicated for any culture. So I think that it's important that we all work together to bridge the health equity gaps in our state. And we need to keep this ball rolling. We must be diligent and, intentional about providing culturally responsive, appropriate services. People are needing that, they're wanting that. We actually see people that, have never tapped into services. And, this is the time where they're feeling safe enough to come out. And so with these health equity gaps, the only way we're going to bridge that is to work together and serve people where they're comfortable and where they need it most. And this is in the communities.
Thank you. Christian?
Sure. Yeah, sure. I think that, I think that what Dorothea and Donna and my program all are, have in common is that, you can't just complain your way out of a problem, right? You have to create your way out of a problem. And so even if you create something imperfecly, and the podcast is not perfect, right? But it's better just to create something, to do something. And with regard to the podcast, it's probably the smallest thing of the three of our programs, right? But I would say go for it. There's obviously a need, as Dorothea and Donna both mentioned. Stories matter, and so it's hard to do a statewide. I can't even imagine doing a statewide program like they've done, which is so impressive. But if I can do a podcast, I think anyone can. And so if you think that there's a value for replicating a podcast in your community, like I said, it costs $350. So it can be done, and the technology makes it so easy. So I say go for it. And if anyone ever needs help or advice, they can always get in touch with me.
Thank you. Donna?
I would say patience. Legislation requires patience. It has taken our country how many years to even move toward having paid family leave policies at a national level, sick leave policies, 20 some years, Voting Rights Act. All of these things take a lot of patience, but don't give up. Don't always start in the middle. I say start at the extreme so that you have somewhere in the middle to meet.
Thank you. I really appreciate it. And for our audience, I'm going to be dropping in the link where you can go and visit our, visit and learn more about the award process and the application and look at the list of our past awardees. With that said, I'll hand it over to Calvin. Thank you.
Thank you, Tatiana, and thanks for you all for spending this afternoon with us, and thanks to our winning organizations for presenting their innovative programs. I'd like to put up one quick survey for you all to fill out. I'm going to launch that right now. And so that's just so we can get a little bit of feedback on how we did. We'd certainly appreciate your response. If you'd like to keep in touch with FCA, you can find us on Twitter, Facebook, YouTube, and of course our website, caregiver.org. We also publish 2 newsletters, Policy Digest, focusing on legislation, public programs, and policy on the state and national level, in addition to Connections, which highlights issues and information important to family caregivers. So with that, I'd like to leave the line open in case you need a little bit more time filling out the survey. But again, thanks to you all for attending. Thanks to our presenters for sharing their afternoon with us. And we all wish you to be safe and have a great afternoon.